Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about pulmonary fibrosis. This is a condition where the lungs slowly turn stiff and scarred, making every breath feel like a struggle. It affects thousands of lives and often goes unnoticed until it's progressed. But there is hope. With new medical advances, a mixture of traditional and regenerative approaches, and stories from real patients, we're here to explore what it means to live with this disease, not just survive it. Joining me today is a very special guest, a pioneer in regenerative and integrative medicine, Dr. Bryn Henderson. Not only a physician, but a visionary whose work on the front lines of innovation and helping patients breathe better, live fuller lives. So thank you, Dr. Henderson, for being with us today.
Well, you're sure welcome.
So what exactly is pulmonary fibrosis in plain language for our audience?
It's when the lung tissue becomes thick and stiff over time due to scarring. Scarring that changes what used to be a sponge, soft and stretchy, into now something that's hard and rough, and it doesn't have a lot of give at all. It's hard to take air in, and it's hard to breathe air out. It happens slowly, often starting with a dry cough and breathlessness. And over time, even simple tasks like walking or talking can feel exhausting.
So if a patient comes in and they have a dry cough, do I, as the physician, should my brain go to the worst case scenario?
No, but you have to ask why. What's the cause? And the cause can be determined rather rapidly if you do a very sequential evaluation. And first and foremost is probably listen to them. They'll tell you if they have a history of exposure to dust, chemicals, or multiple infections. Some may even have autoimmune disorders becoming so common. But many people, we don't find a clear reason. We call it idiopathic pulmonary fibrosis, which means we don't know the cause. But it doesn't mean we don't treat it. Genetics, smoking, or experimental exposures can all play a role.
All right, well, let's talk about those symptoms. How would someone know they might have this condition of pulmonary fibrosis?
Start slowly for sure, and it starts with a dry cough. You feel out of breath doing things that didn't bother you before, and you have a tightness in your chest. Even climbing the stairs or walking across the room makes you feel like you're working too hard to do something simple. Over time, these people lose weight and feel tired. They're not getting enough oxygen in. They notice their fingertips. They're rounding, getting wider, and sometimes they even change color, becoming more dusky. These signs often creep up on people, which is why many are diagnosed late.
Wow. So if someone's out there and they have a loved one or a grandmother, grandfather, mother or father or aunt or uncle or that's older, and they say, gee, what happened to my mother's fingers? They look weird. Could they encourage the person to go in and have their lungs checked?
Absolutely. In fact, one of the first things to do is to hold their hand and see if it's warm or cold. If it's cold, for sure, you want to look at the color. And then have them see their physician so that somebody can listen to their lungs and do a breathing test. We use a combination of these tools, the most important which is a high-resolution CAT scan that shows us the pattern of scarring, if there is any scarring in the lungs. And especially when you have underlying scarring, you need to have the breathing test done to determine function. Anatomical is not enough. You have to have function too.
Okay, so do you automatically send somebody to a pulmonologist, or do you keep them around for a while and see what you can do early?
Well, the first thing you do is a breathing test. And if that's not normal, you better be getting a CT. Mm-hmm. It's faster than other things. And then if that's abnormal, I think they need to be seen by a pulmonologist to evaluate more than just causation of this, what else is going on with them. The radiologist can even guide you.
Okay, so genetics?
Oh, for sure. There's some people that are born with the genetic variations that make you susceptible to lung disease.
Wow. So, all right. So now you've done a spirometer on them, you've done the CT on them, they have a family history, somebody else in their family had it. Is it a death sentence or what are we talking about here?
No, it's not a death sentence, but it does take a lot of testing and a lot of training to make sure we get the right diagnosis.
You have medication for it?
Yes, you have two kinds. One that opens the airways, it's called a bronchodilator, and the other is one that decreases the inflammation, and that's usually a steroid. And those two, coupled with oxygen, which is now becoming a drug if they need it, those three things help them live a normal life and help reverse some of the damage.
So, all right, patients come in your office with dry cough and you do the spirometer. What's the spirometer numbers that are bad?
They give a percent of normal. So there's only two, right? You're breathing in, inhalation, you're breathing out, exhalation. So breathing in and breathing out should all be in the 90s. If either one of them's below 95, you better get it checked.
Okay. All right. So now you've pioneered some regenerative approaches, just like you've done for probably every pathology known to man. But in pulmonary fibrosis, what are your regenerative approaches?
The regenerative approaches have to do with peptides. Those are proteins that help, and BPC 157 and thymosin alpha 1 help reduce inflammation and support the healing. We also have to get nutrients in there. Glutathione and NAD+, plus some high-dose vitamin C boost the body's immune system and natural defenders. These don't cure the disease, but they sure help the patients feel stronger and breathe better. Whether we need oxygen or not is going to be determined by their testing. You can also teach the patients the Fibros method, a simple way to remember daily steps to protect your lungs.
All right, let's do it. F stands for?
Follow up regularly with your physician.
I.
Inhale oxygen if needed.
B.
Breathe through exercises like pulmonary rehab.
R.
Is reduced exposure to irritants, smoke, dust, chemicals.
O.
Oxygenation.
Okay. And S.
Stay on the medications like antifibrotics.
E.
Is eat well and rest to support your energy and healing.
All right. Now let's talk about one of your patients that you had lately that came into your office and tell us about his health journey.
He came to us after struggling with breathlessness for 3 years. He had worked in construction and had a long history of smoking. A CT scan confirmed idiopathic pulmonary fibrosis. We started him on standard meds, added regenerative therapies that were weekly IVs, peptides, and antioxidants. Over the next year, he went from using oxygen and barely walking to being able to walk 2 miles a day without oxygen. His lung function stabilized, and more importantly, he got his life back.
Oh, I love that. I love when we're successful having people not go down to a worse stage of their health. So what would you say to people who are listening who might be dealing with this particular disease of pulmonary fibrosis?
Begin with you're not alone. We can help you. We have a lot of experience in this, and we are able to support your lungs, your energy, and your mental health so you don't get depressed. Act early and act strong. It's about getting your lungs better, and we help you breathe better.
Well, I'd like you to consider going to Dr. Bryn Henderson's office in Orange, California. His phone number is 714-639-4013. And make an appointment, see what he can do for you, and I know he can help you because I worked in his office and I watched him help person after person after person have their life improved, their health improved, and his compassion and empathy with you is noticeable from the second he walks in the room. And you will be very happy making Dr. Henderson your doctor. If you want more information about me and my hormones and my supplements, please go to www.askdrhelen.com. That's www.askdrhelen.com. So that's all for today. Please join us next week with another Doctor to Doctor show where knowledge breathes life into healing. Join us next time. Bye for now.